LaShannon Spencer is the CEO of the Community Health Centers of Arkansas. Her nearly 150 clinics and centers have been deeply impacted over the past year by the COVID-19 pandemic. I caught up with Spencer to learn more about what the past year has held and what's on the horizon. I think a lot of people may know what a community health center is in your network, but they may not know what a community health center is in your network. So explain to me what the Community Health Centers of Arkansas are so that people understand what all you represent.
Sure. Community health centers actually provide primary preventive care, mental, behavior, dental, and vision, and other enabling services. So a community health center actually is a patient-centered medical home that offers primary care services. And all of our physicians, clinicians are actually board certified. And we see uninsured, underinsured on a sliding scale fee. We also see commercial payer patients as well.
All right. And there's over 100 community.
There's over 130 sites actually across the state. And so not only just sites, but we actually have school-based health centers as well in many of the communities that we serve.
Good deal. So let's talk about what you have been experiencing over the last year. Obviously, in the COVID-19 pandemic, a lot of different health organizations have been impacted in a lot of different ways. Tell me what has been the utilization of the community health centers over this last year, maybe if things have changed a lot over the course of 12 months.
Sure. You may not recall, but Community Health Centers of Arkansas actually partnered with the governor, and we made a pledge to the governor to actually get so many folks statewide tested and access to COVID-19 tests. And so for a 1 month period of time, we actually tested over 45,000 individuals for COVID. And so COVID has really just taken so much of our time, but not just the COVID testing, but also been able to now offer the COVID vaccine to our patient population. And not just the patient population that we serve, just being able to offer it to anyone within health center service areas.
So what are you seeing in vaccines right now? Are you seeing more demand than supply, more supply than demand?
What I'm seeing now is more supply than demand. So, when you start thinking about it, a lot of our health centers are actually located in rural communities. So there's still that vaccine hesitancy, just because, it's been such a polarized issue and most people don't understand the significance and the importance of actually being vaccinated. We now have 3 vaccines. You have Pfizer, Moderna, and Johnson & Johnson. And when you look at the bigger problem, we really won't rectify until we reach herd immunity. And so we need everyone to ensure that they're actually vaccinated. And now, there's no more look at the different categories of the classification of who can be vaccinated. Anyone under the age of 16 and up should actually be vaccinated.
So you mentioned that vaccine hesitancy there, and that it's become such a polarized issue, the COVID-19 politics in general. What do you think is going to turn it around? What's going to help eliminate some of that hesitancy? Because we've got to get up to around 70% for herd immunity in this state. I think we're in the teens right now from a completion standpoint.
And you're absolutely correct. What's going to be key and essential is we're going to have community leaders to lead by example and to become vaccinated. When we look at this, people trust their local community leaders. And so not just education, but we're going to really have to partner with local elected officials as well as community leaders in order to help really impact and change and persuade people the importance of being vaccinated.
Last question for you. We have a legislative session that I've lost count what days they're on. I think they finished week 10 this week. I may even have that wrong. I'm not sure. So it's been too long. I can tell you that.
It's been an interesting session to say the least.
Yes. What's one of the bigger issues that you are still monitoring up there from the Community Health Center's perspective in terms of how it may impact you all?
Right now it's actually, Roby, and that's a good question. It's 340B legislation, and 340B it really helps. It's a cost saving prescription drug program that benefits not only community health centers, but it benefits critical access hospitals and hospitals. And it's a savings program to really benefit the patients. And so that's a key issue. And, our AG, she has really been on top of it and actually leading it from a national perspective when it comes to pharmacy benefit management programs and 340B. So AG Leslie Rutledge has been very supportive. And so just watching and monitoring 340B legislation.